Thank you for joining us for yet another edition of Highlights of Mwambao. And today we are looking at the shrinking space of key population in our society, including the effects and challenges brought about by the matter of the pandemic. But first and foremost, we want to recognize that key population includes a number of members of our society, and globally, these populations are particularly vulnerable and disproportionately affected by HIV due to certain risky behavior. Marginalization and structural factors such as stigma, discrimination, violence, human rights violation, and criminalization, all which contribute to a lack of access to health services. In 2020, key population and their sexual partner accounted for 62% of new HIV infections globally. Key populations are often difficult to reach for critical testing, care, and treatment services. They face a higher risk of acquiring HIV and have higher risk for onward transmission, and yet their access to service is limited. Globally, their rate of accessing safe, effective, quality HIV services are extremely low, while stigma and discrimination, including gender-based violence, are high compared to general population. Significant barriers such as police harassment, societal discrimination, and insufficient community-based services prevent them from getting the care that they need. So I want to welcome you, our guests, for today's session. We already have one who is here with us, and of course, the next guest will be joining us. And karibu sana. I'll request we get to know you, who you are, where you are from, what you do, what you engage in, and then we shall proceed from there. Karibu.
Asante Loli, thank you for having me. My name is Benta Joseph, and I work with Coast Sex Workers Alliance, that is in the Coast region. And Coast Sex Workers Alliance, we advocate for the rights of sex workers in the coastal region. Asante.
Thank you so much, and thank you so much. And as we are progressing, we note that the issue of our community are actually changing over time, and sometimes they are very sensitive. And you'll find that in some instances, we've seen cases whereby there was some stigma that is being directed at people who are into the issue of sex work. But Benta, maybe to get to hear from you, as much as the issue of sex workers is concerned, what is the perception or opinion of the community to these members of our society?
Okay, since the first case of COVID-19, that was in 12 March 2020, we've been having issues whereby as key populations, we feel like we are having shrinking spaces. This means that everywhere, be it in the health sector, legal sector, and even the mental services, the key populations do not have enough space. And for us being a marginalized community, we are now facing double stigma because of that.
Okay, so now, I mean, when you talk of stigma, what are you implying about, I mean, when you say stigma?
Okay, when you talk of the pandemic that is going on, for sex workers right now, as we have been facing stigma from the community, because we have been trying to get a leeway, we have been trying to educate the community about our work, but the community have not accepted us. They have not accepted what we are doing. And with what is going on, so we face double stigma, because even when we go to the healthcare facilities, the perception of the healthcare workers toward the community, that is the key KPs, is always different from the other community, from the general community. Because the moment you walk into a healthcare facility and you say that you are a KP, the way they are going to treat you is different. Or even if you have not even said that you are a KP, if they just suspect or they know you, the way they are going to treat you is not the same way as they are going to treat the general community.
Thank you so much. That is a great concern that we have seen. We as the larger members of community have an opinion or perception
Sorry, Noli, I'm
around.
losing you. I'm losing you. Sorry,
Okay,
I
thank
can't
you.
hear
Sorry
you.
for that. Um, so I'm just putting it to those who are following us that key population have had the challenge brought about by stigma, and that stigma is what has been pushing them to behaviors or rather inability to access services, and that's stopping them from preventing new HIV infection. But as USAID put it, that there is need of intervention that is community centered. So back to you. I can see that our colleague is joining. Back to
Noli, I
you.
can't hear you. Sorry, I can't hear you.
Yes, I'm saying now that these challenges are occurring in the community and stigma is growing, how are you overcoming it? How are you guaranteeing that you people are okay and safe?
Okay, I'm not hearing you well, but I'll answer according to some few words I got. Okay,
Okay.
what we are doing as the community to try and mitigate the stigma that we are facing. First of all, we have different strategies that we are using. Like we have been doing quite a number of sensitization activities to the community to educate them or to make them understand our work and to know like sex work is work. For example, if I say talk about sex work, which is our work, we try to make the community understand that when I say that I'm a sex worker and I do sex work, they should understand that sex work is work just like any other work. Just like some mama mboga goes in the morning kwenda kuuza mboga yake, or any other person goes to the office to do work, it is the same as for us sex workers. We go because we are working to earn some money out of it.
Thank you
And
so much.
also we have different organizations or CSO organizations that we have been working with or partnering with, whereby we have like trainings for religious leaders and even the healthcare workers. We have been doing different sensitizations to healthcare workers, even the police officers, so that we can partner with them and work together as the community.
Thank you so much for that great input, Brenda. I mean, sorry, Benta. I don't know why I'm calling you Brenda. And I'd want to welcome our other colleagues, our other colleague who has just joined us. And technology sometimes, I mean, has its own here and there. So I'd karibisha you. Welcome. Please introduce yourself. We would love to know you. What do you do? Where do you do? And a brief about the subject that we have today. Welcome, Ezekiel.
Thank you so much, Nolly. I think you can hear me loud and
Yes, we
clear.
can hear. Yeah.
My names are Ezekiel Amenya. I work for Watu Center for Health and Advocacy. I'm also a psychologist, a programmer for AKP programming, and human rights activist in Kenya. On the topic that we have today is thinking of a safe spaces for the key population. This is a reality, and this is something that we need to speak it out. We need to get people need to get a real picture of what is happening on the ground, and the reality is the key population, their safe spaces have shrunk, and they have remain vulnerable than ever before. Thank you.
Sorry, I had muted my microphone. So thank you so much. But my question will be how unique how unique is the programming, and we'd wish to understand one, how unique is the programming, and then two, how, or rather, what is the community's perception or attitudes towards the programming that is meant for key population, but if it will be possible in the context of the pandemic that we're facing.
The programming, the community as yes, there is a little bit positive response on the programming around the KP, but again, many people in the general population does not understand what the programming around the key population is, and what are the some of the positive benefits that everybody is getting from key population. Let's say let's start from the sex workers, around the sex workers. When sex workers are empowered and the sex workers programming are in Kenya, we know that key population contribute to quite a big number of HIV prevalence new infection in Kenya. One, the sex workers is contributing to around 30 and above % of the prevalence rate. The MSMs is at 18.2 currently, and people who inject drugs are at 18.3. So if this combined together is more than the general population nationwide prevalence rate on HIV. So this, when this is taken in consideration and the programming are done properly, then we will be seeing a lot of reduction of new infections of HIV. So this is some of the things, that's why the government has picked it up, and we as a community and the programmers, we are looking at it. That is another way of reducing HIV infection and any other infection, sexual reproductive health services which are geared towards this will definitely give Kenya a notch high on reduction of even the expenses of budgeting on the reproductive health. Again, when it's come to pandemic, it has affected our programming in a way that, one, let's start with the example for the sex workers. They used to work during the night. Now, there was a partial lockdown, and there is also a curfew, which starts from around 10 p.m. to 5 a.m. in the morning. So their work is affected. The people who inject drugs, some of them are homeless. And the brutality of the police, and where do they stay? The government does not want to see anybody on the street past curfew hours. And these people stays on the streets. Where do they go? These people hustle to get a living. Where do they go? The MSM's community, they were used to have a solace in the safe spaces, which in the diocese. In this diocese, where they would go and have a psychosocial support from other counselors and from their colleagues. These dioceses are no longer accommodating many people. So there's a shrink and there's insecurity for the all spectrum of the key population.
Thank you so much for bringing in that important issue, which is more or less the work relations between members of the community and, of course, the duty bearers. So, Benta, maybe to hear from you, how, or rather, what is the relationship between the members of the key population community with the duty bearers? That includes the enforcement officers, both national police and the county, the Ministry of Health. Yeah. So what is the relationship? How good, or how is it going? How is it faring? Karibu Brenda. I mean Benta.
Okay, call me Brenda. Okay, when you come to the legal aspect, we realize, like, for now, you can see that niko na meeting. Tuonge baadaye, niko na meeting. Sorry about that.
No problem.
Sorry, guys, working from home.
Aina
When,
shida, we
when it
understand.
comes
It is the right.
when it comes to the legal services, like for example, the courts have turned into virtual hearings that have limited tracking of GBV cases. And also you see that okay, the courts have turned into virtual hearing that has limited tracking of GBV cases. Okay, and because of our vulnerability, we are seen as we aid crimes or criminals, and this has hindered us to access legal services and legal and spaces. Hello, Noli.
Yes, I can hear you. So,
Yeah,
I
and this
mean,
has hello.
yes, proceed.
Yeah, I was saying, and this has hindered us to access legal services and spaces.
Okay. That I
Yeah.
mean that seems to be so interesting because everybody has a right to protection irrespective of who or where we are. And maybe Ezekiel, from your end, as much as the relationship between the duty bearers and the members of the community who we are serving, how is the relationship? You've talked about the programming being unique, but there comes a point whereby the member of KKP rather will need to seek medical services, reports a case, will need justice. What is the response from those duty bearers as we speak right now? Karibu Ezekiel.
Okay, let me start with the police. There are lots of sensitization that has been done around the police on the KP uh, rapid response, and still there's still laxity in the police department, taking up and following up these cases. Let's see, like in the month of the same month, we had a case of a killing in Mombasa, that is Bamburi. One of the human rights defenders, the person was working for the in a key population organizing in coastal region, and he was a legal officer who was following a lot of cases. So we do not know whether this was as a result of the cases that he has been following up, or some of these things that has made it possible for these people to track him and kill him or murder him for that fact. The duty bearer, when you take a case to the police, it takes a long time. Police telling you to follow up these people. They have all the instruments of power. They have all it takes to investigate and bring to book the offenders. And now they turn to victims to look for offenders. It is not right. They are also slow taking the gender-based violence geared towards the key population for the sex workers. For example, the last year or early this year, there was also a attack for the sex workers in Bombolulu. Police did not do anything. We followed up this case. The sex workers were being beaten every now and then, every evening. They even injured some, and we took them to the hospital. They reported this in various police stations in Mombasa. No action has been taken up to now. A colleague, human rights defender who was killed, murdered in his house. No reports, no arrest has been made, which means there's laxity. The sinking of safe space for the KP is real, and something must be done, and somebody must be held responsible. Noli, unmute yourself.
trouble in the world. Thank you, Ezekiel, for being on the lookout and bringing you back, Benta. We are seeing that we are trying to work so that we can get something to take care of ourselves, including those who depend on us, and we tend to be frustrated, and we get into other activities. And I mean, there are those who use or inject drugs for that matter. Um, I'd want to hear from you, Brenda, maybe. I mean, Brenda. No. I'd want to hear from you, Benta. What are some of the interventions which the government needs to do to make sure that we are in an equitable and just society? Ni nini serikali inafaa kufanya kuhakikisha kwamba, because there are those who found themselves in sex work, there are those who use or inject drugs, not because walitaka, but it was a circumstantial situation that they found themselves in, and they're trying to work out to get out of it. So what are some of the recommendations which you'd put before the duty bearers so that the society lives in harmony? Brenda, can you hear me? Brenda, can you hear me? Okay, we seem to have lost Benta. Technology sometimes is a hindrance. So, Ezekiel, from your end, maybe we've seen that the working relations are not good, and they are going to points and times where we are losing life. How do we go about that? How can we mitigate these issues, these deaths? I mean, these injustices that are brought upon the members of the key population? Karibu, Ezekiel.
I think the best approach for this, and the ultimate intervention for that fact, is we need to work in. We need to create a conducive environment, working environment with the law enforcers, of which we have done. We have trained many police officers. We have trained many court users committee, and that is the High Court magistrates and lawyers to pick up these cases. But we need to do more on these sensitization meetings. We need to build a conducive working relationship with them, because when, for example, a drug user is arrested, and this person is an addict, and sometimes the government have introduced a very good clinic for methadone, that is medically assisted therapies clinics, which we have one in Shimalachewa, we have one in at Freetown, and the one is being constructed in Portris that will start working very soon, I believe so. So if someone is a drug user is arrested, they need to know the details of this guy, and also assist him to get the methadone, so that this guy cannot. This can prevent relapse on the other end of the drug users. When it comes to them sex workers, generally we've also done a lot. We've even brought all the police force to the highest, the county commissioner and his team on board in several locations. We've talked about this. We've had closed door meetings. We've had open discussion with them in various places, just to create safe spaces for KPs in Mombasa. And this is slowly changing. We're seeing that the positive response, but this is so minimal. We need to see vibrant changes in the police force picking up these cases and also acting on them. And we see prosecutions in courts. People are being jailed. People are being punished for the offense that they have committed, against the sex workers, against the people who use drugs, against the LGBT persons. And now you ask something about the drug, how the interventions that around the drug use, or you asked that to Benta. I would love also to just a brief talk about it. The intervention which is taking place now is very good. And again, we need to have more methadone clinics in every sub-county so that the drug users who are coming all the way from Likoni can have a match clinic in Likoni, access that services in Likoni. And those who are around Mvita can find it within Mvita and access it within Mvita. They have to speed up the one which is being constructed in Portrees so that those who are coming around Changamwe can access that Changamwe. And the other one is being, the Nakada set another one in Miritini, which is so good, that will serve the people of Jomvu, so that we can have access of these services nearer to the users. Thank you.
Thank you. Thank you so much, I mean, Ezekiel, for that great input. Benta, at least now I pronounced it well, Benta. From your end, I mean, we observe that the nature of activity which members of the key population involve themselves sometimes put them at risk. For this case, risk of contracting HIV. And this basically can happen because sometimes we know that there are cases which are violent in nature. So mine is to find out that are there proper services in place that are being done to protect the members of KIPI, I mean specifically the CSWs, so that even in the course of their activities, they are protected, or rather they are away from the risk of gender-based violence and HIV transmission.
Thank you, Nolly. Okay, with the ongoing pandemic, we have been having so many issues whereby sometimes we have been having issues like the IPV, intimate partner violence incidences happening. And we have been having so many members of the community who have been undergoing through different kinds of violence incidences. And what we have been doing is we have been sensitizing them online, and we are telling them we are teaching them on ways on how to mitigate, how to stay safe during this pandemic. And in case a sex worker is violated when she's on duty or when she's out there working, we have hotline numbers for different police stations where they can go, or where we can call and they can get help, because we are also working very closely with the gender desk police officers and the gender desk officers in different police stations in the coast region. And we also have paralegals in place, whereby if a sex worker has been violated because they work in different cohorts or different groups, they make sure that if they get a case, they report to us and we see how a sex worker can be assisted. And if in case it is a case of rape, we link the sex worker to a nearby facility where they can get PrEP, where they can get PEP. And also we have sex workers who are on PrEP. And so that is how we work with different sex workers in the community. Thank you.
Thank you.
And before I forget, we also have some facilities which are very friendly to the community, and we always tell the community, or we link them to go to get services there. But because since the pandemic began, there are these facilities which has been turned into isolation centers. And so we find out which facilities are still available, and we link them to the facility so that they can get help. Thank you.
Thank you so much. That is, I appreciate the coordination that exists between, people who are into sex work and health facilities, because, like I said, our laws at the moment have criminalized sex work and drugs and substance abuse. I'm wondering why they did not, criminalize drinking alcohol, but they decriminalized the other drugs. It's interesting. Both of them are drugs, but one has been criminalized and one has not. So thank you so much, Benta, for that insight. And just coming to you, Ezekiel, we are in times that are hard, and they are challenging, and globally, people and governments are trying at their best to mitigate the challenges of the pandemic. So my question is, how has the mitigation benefited members of the key population? We know our county was distributing relief food. We know right now there are issues to do with, chanjo is being given out. Right now there are isolation centers. So my question is, has the mitigation of the pandemic in any way affected the members of the KPs? Karibu, Ezekiel.
To start with, if it has affected the KP, that is true. It has affected the members of KP in a very different ways. Normally, you see, the KP are very vibrant people. They want to go out and make a living. And if they are confined in a place for a long time without going out to get bread for their families and from themselves, our work is interconnected in one way or the other. And our vulnerability, the vulnerability of the key population, is higher than any other general population. This is because of stigma and discrimination. For to say that before even the pandemic, the LGBT community went to court to repeal 162. And this one, the court threw it out because of lack of evidence, which is a laughable matter to me, because there's all evidence. There's violence, there's murder, there's serial killing, there's blackmail every day for the members of LGBT. And the court come and say there's lack of evidence. It is a laughable matter. Because even if this thing that was the LGBT took to court, it is not benefiting only the LGBT. People should understand this. The repeals 162 is not for it's not for the LGBT. It's not around the gay marriage as per se. This is something which is affecting everyone in Kenya. And the government wants to determine how people should have sex, which position they should have sex, when they should have sex, which is not. People have a right to privacy. Their privacy, the government wants to control the privacy of everyone. So when the repeal 62 was thrown out of the court, of which I know the LGBT community are still fighting to go to Court of Appeal to listen to this case again. And I'm sure they will win. This created a lot of insecurity for the LGBT community in Kenya. They are living in fear. And you can see many have been murdered. Now that they have not been more into the community, they are now back into the community because of pandemic. This has created a lot of tension. This has created a lot of mental health problem to the LGBT community. And this also has created a increase their vulnerability in the community. So the pandemic has affected the key population. The pandemic have affected the MSMs, the LGBT spectrum. It has affected the sex workers spectrum. It has affected the people who use and inject drugs in various ways. One of them being the health services has been, the system has changed. They cannot go there and being served. The government has given first priority to the COVID-19, which affected some of them who are on the ARVs, those who are on the care, those who are on the PrEP. Some have defaulted, and there's a lot of follow-up cases in these CCCs we have in the county. So this has affected them health-wise. Their security is another social life which has been affected. Economy. These people would want to go out, but some of them do not have formal jobs to say. There are people who hustle from one hustle to the other, and these are the people that some of them would work at night, and nobody is working at night in formal sites. So this has affected them in a serious way. We need to find a way to cushion their life during this pandemic. The government, yes, distributed some relief foods, but to be sincere, it was not distributed in a proper way, in a good channel. What we thought people would benefit, some of the government employees, and I know some, benefited. A wife is working in the as a civil servant, a husband is working as a civil servant, and they could still have access to this relief food, which was bad. This thing was meant for the people who do not have, who are affected. Their jobs were affected by pandemic, but the key population did not get. The sex workers did not get. I do not know even a sex worker who got that relief. I do not know any person who used or inject drugs who got it. I do not know any LGBT or MSMs who got this relief food. These were meant for specific people, and sometimes people were complaining it went for a specific religion. Yeah.
Thank you so much for that opener. And I'd ask Benta to take it further. The response to the pandemic, how has it been on your end? How has it been for the members of the CSW community?
Okay, to echo on what Akim has said, since the pandemic, we continue to see shrinking safe spaces for key populations, and this has led to inaccessibility to legal services, sexual reproductive health services, and as well as the mental services. And when I talked about health, just like Achim said, you realize that all the facilities right now are focusing on COVID mitigation. And this has been very difficult for us as KPs to access healthcare services. Like, we have so many cases of sex workers who defaulted their ARVs. Apart from that, also, you realize that the ARV drugs right now, there is a very big problem about them. Like, we used to go for quarterly refills, but right now we're given like for 2 weeks or 1 month. So we see that it is our right to have the ARVs, but now the government has lowered us to taking the drugs for 2 weeks or 1 month. And also sexual reproductive health services. We realize that people can no longer go for pap smear services the way they used to go. And some of us, we even fear going to the facilities to get these services. And the friendly healthcare services have been turned into isolation centers. So people are wondering, where can we go? Like, sometimes last month, we lost a sex worker because where she used to go for her services, it was she was reported to Afghanistan, but the facility had refused to answer her. Unfortunately, when she came to tell us about this case and we started assisting her, it was a bit too late because we tried our best, but unfortunately she passed on, which was very sad. If the facility could have listened to her from the first time when she started complaining or asking them to support them with whatever she needed, it could have been easier. It could have been easier. And also, when you talk about family planning, we realize that so many sex workers right now fear going to the same healthcare services because they fear going there, and maybe it is an isolation center. They also fear contracting COVID-19 and the way they have been trying to keep themselves safe. So we realize that in all the areas, the spaces are shrinking for us. Thank you. Over to you, Noli.
Thank you so much, Benta, for bringing that out. And I mean, sometimes I fail to understand why I move into a profession, and while I'm there, I'm offering my services selectively. And I'm very much concerned when KPs cannot access, I mean, basic services that includes issues around family planning. Yeah, I mean the P9 form. Is it the P9 the form that is filled for? I mean GBV cases. I mean
Yeah.
it the P3 form. Sorry, at the police stations. It's
Yeah.
very unfortunate. So, I mean, back to you, Ezekiel. I mean, just to open up into another perspective as we discuss the issue of culture, religion, and beliefs. Yeah, how does it affect service provision? How, because right now people are going back to their communities, and you'll realize that sometimes we usually say in Africa, when things have hit rock bottom, we always run back home. Yeah, and back at home we are guided, or rather we are held by issues around culture, religion, and belief. So I'd want you to give us a context how culture, religion, and belief has affected the members, or rather people in the key population society. How was it? How was it contributed into their lives as they're living right now? To you, Ezekiel.
I think community have set standards. Religions, to say they have set their standards, and the religions are being guided by the doctrines that they hold to their chest. These religion doctrines, religious doctrines, uh, and also standards for the community is affecting the work of programmers like us in the context of key population. One, in the lenses of the community, when they see a sex worker, they start judging them and saying, these people this is not African culture. I want to understand what is remaining, which is African culture today in this world. Because all the practices that we practice today are not African culture then. We have borrowed this culture. So if we have borrowed this culture, so let's everybody not judge anyone in the context of culture. Because I don't understand what culture do you have. I speak a foreign language today. When I have to go out there and I want to communicate, I communicate a foreign language. If I want to go there, I wear a clothes which have been made by foreigners, not our culture. If I want to do things, I do them in a different way. So which is our culture? People still hang on the things which are not there. The cultural practices are no longer there. That is to be the truth to be said. And this is I don't need to prove myself when I'm talking about culture. I don't belong to any culture. I'm a human being. That's my culture. So the people have their standards that they put people in the weighing scale, and if you weigh less of their standards, you are odd one out. When they see a sex workers, they put them to a weighing scale, and if they cannot weigh the kilograms or the grams that they want, then you do not deserve to be in the community. They look you with the lenses of immorality. The drug users have suffered so much in the hands of the community or in the hands of religious leaders, in the sense that they have set standards. These are the things that we need to use. Drinking culture is a culture which is can be dated back to 14 or days before Christ. People used to drink, but as people used to drink, there was also addiction during those times. There were ways on which people in different societies and communities were managing addiction. This has not been put in place. It has shrunk. It has disappeared. They have used the other lenses, which the lenses that they have been using before, our forefathers used before to deal with addictions. They are no longer using it. They quickly put people on weighing scale. They put on the lenses, and they want to look the drug users or the key populations with their own lenses, and then they judge them. This has affected the work of a key population, not only in Kenya, in the whole Africa continent. But I'm afraid that because of the shrinking spaces, the key population has no peace. There is violence eruption, just as a result of people do not want to accept the truth. The issue of homosexuality, it has been there for centuries, for years and years and centuries. People do not want to tackle or to talk about this topic in their homes, in the churches, in their mosques, in the places in the social spaces. They do not want to talk about this thing. Even if they talk about it, they talk about it in low tone. Let us come to a discussion. Let us discuss things, the social factors that affect the life of every person. Let us reason together. As a Christian, as a Christian, I believe that there's a call that says, come, let us reason together. And that is in the book of Isaiah, which is chapter 1, verse 18. Come and let us reason together. If Kenyans can come, if these communities can combine forces and come and we reason together, we're going to get a lasting solution for the key population in Kenya or in Africa. This is my call. If we can dismantle all our religions, I don't say that you do not go to church, you do not go to Muslim, but can you for a minute become a human being and reason with your fellow human being on the same level, without judging them, without stigma and discrimination, without the cultural practices that we hold. I belong to a certain community in Kenya, and I believe there's other practices, cultural practices, that when I meet my kinsmen, they expect me to be on that standard. Can we just leave that apart. Just be a human being for once, and then we reason together. Then we discuss the issues that are affecting the key population at a common ground. Creation of a common ground. Living back our traditions, our religion, then coming to a common ground where everybody is being weighed with the same scale. Everybody is being looked at with the same lenses, be it clear lenses, be it tinted lenses, but the common ground. This is what will save the key population in Kenya and in Mombasa to say.
Thank you so much. Those words carry a lot of weight, which, I mean, it's only someone who is deaf who might not take them with the weight that they so deserve. And maybe back to you, Benta. Our religion and our culture, how has it affected the space that is existing for the key population? Right now, we are in the pandemic. There are those who went back home. There are those who are living in our various societies. So, how has religion, culture, and belief affected the members of the key population in your perspective? Karibu.
Asante. The key populations, we continue to suffer a lot. And it's that when you are a key population, people where you all look at you with a different perspective. Like here, culture plays a very big role in stigmatizing us, because the moment someone hears that you are a sex worker, you are looked at as like an outcast in the community. We always sensitize we have been doing sensitization to religious leaders, but they have never accepted us. We have tried and tried and tried to put them on, to sit with them on the same table. We talk, and when we finish the discussions, when everyone goes away, the stigma still remains. When you meet them, they still look at you with a different eye. And it is so sad that they still refuse to accept us. We want to tell them that we are human beings. We are all human beings, and it is high time they accept us, they accept that we exist, and they accept that we are their children. A sex worker is your sister, is your mother, is your father, is part of your community. So it is high time they accept us and live with us. And they should stop looking at us with a different eye. They should not look at us like outcasts in the community. And all this is because of the Kenyan Constitution and the punitive laws and the culture in general. We have no space as KPs who are vulnerable. We have no space. There is no space for KPs who are working as sex workers. People from the community, we urge you to accept us and start working with us. It's high time we come together, we sit at the same table the way we have always been doing. It is not that we are doing for the first time, but these things we have been doing and doing and doing. We want you to accept us. Even with the ongoing pandemic, accept us, take us in. Not that when I come to knock at your door, if maybe I have an issue, you say that I'm a KP or a sex worker, so you cannot support me. No, I am your sister. You should accept me so that we can work together and all live together. Thank you. Back to you, Noli.
Thank you so much for that, Benta. And it's a challenge because you see when we make our way to the city, sometimes what we come to encounter varies from person to the other. And I mean, the way Ezekiel had brought it upon us, the story of, I mean, from the Bible, and also there's another story of the prodigal son who happened to come and ask the parent for his rightful dues so that he can go and start his own life. And it's one story that really encourages that irrespective of the way, of the ills, of the evil, of the bad, of whatever we've done to our parents, yeah, we should be encouraged by the story of the prodigal son. And just to bring you back, Amenya, I mean, all of us are suffering right now, more specifically around issues of mental health. And I appreciate that you've indicated you are somebody who provides services for people who are affected by that area. So maybe for those who are listening to us, who maybe one might be having a family member who is a member of the key population, or even a member of the society who is undergoing challenges that are leading them to possible actions due to whatever is affecting them mentally, and also to the society that we are in, whatever they are doing to the key population that is affecting the KPs in a mental manner. I'd wish you to put across how can we take care of our mental health if we're in those contexts. One, the family member; two, the member of the key population; and three, the society that feels they are affected by the KPs. Karibu Ezekiel.
I think for many years I've provided mental health services to the key population, and that is my area of specialization and area of expertise. This has been a challenge. We've been seeing many trends of mental health disorder among the key KPs. But when you try to follow it up with them, it's as a result of something which started like a stigma, and then it grows to be a stress. Then this stress developed to a depression. And most of the time they run away from home. And that is when the pandemic came, they left their safe spaces to go back home, which is full of challenges. The people in use drugs, they used to live in dens. And now the dens has been disbanded by the government because of social distancing, and that they have to go back home. This during the pandemic, the key population, as I have said earlier, developed many mental health disorders. And this has made it more possible for we will see the impact of the pandemic. We have not seen it yet in terms of, because what we are seeing now is just stress. We are dealing with stress management. Some have gone into depression, yes, few. But in some months to come, or in a year to come, we'll see a lot of challenges in terms of mental health. Some of the things that we really want to appreciate is that the government has developed a framework. They did collect views, public participation in different counties, and they have developed a roadmap that will guide on how to deal with mental health. In terms of addiction, there is low. The staffing in terms of addiction counselors is very low all over the country, and NACADA must look into this, because some of the challenges that are being posed, if you go to mental health units, like if you go to Portrees, 75% of the patients who are in there are as a result of drug and substance abuse, which need to be picked up by trained addiction counselor that can articulatively intervene or create an intervention strategy on how to help these people. But this has not been done so far. We have trained few psychologists that can take up the task, but we really need addiction counselors to be in every health facility, equally with the doctors, the nurses. Government really needs to invest in mental health because this is killer disease. It's killing in silence. That's why people does not realize that mental health is killing many Kenyans. If you see today in most of the media houses, you'll never miss a family who has killed another, murdered another one family, a woman, a wife murdered by a husband, a son murdered a father, a son murdered a father murdering his children, or killing children. So this is as a result of mental health problem or challenges to say. It is real. It is here with us. It is affecting key population than any other person. And the reason as to why the general population, all the people around, all the society, or even the church and or religious people does not want to face their fears. It is time for Kenyans to face what you fear most. The topics, the hot topics that we do not want to tackle or to talk about, we need to start talking about them because that is where the mental health starts. And if we are ready to open up and talk, the areas that we don't want to open up in are the areas that we need to open up in at this pandemic time so that we can have less stress to deal with. We can have a light load to carry around because the load, you having the mental problem, you have bottled a lot of things. Kenyans have bottled a lot of issues. Families have bottled a lot of issues. It is time to start slowly opening up these bottles that we have. The bottles that are carrying a lot of issues so that we can completely empty these bottles, and then we can face our fears, face the pandemic with no fear, light luggage, because mental health is real, it's killing us, it's devastating every family in Kenya, but more key population because of stigma and discrimination against them, just because their work as a sex workers, just because of their behavior of a drug use, just because of their sexual orientation and gender identity.
Thank you so much. And I'm seeing like the mental health of members of the key population is by a bigger percentage being contributed secondarily, not because it came out of them, but because of things that I'll say are secondary that are coming from other places. And just to bring you back, Benta, how are we overcoming, the mental health challenges? Yeah. How are we mitigating the impact of mental health challenges for members of the key population at this point in time where people are stressed, there is no money? At this point in time, the way Ezekiel has put it, there is stigma that is coming from the society, from families, from parents. How are you equipping and empowering the members of the society to come to terms or to mitigate issues of mental health? Karibu.
Okay, the pandemic came with a lot of anxiety, and since the pandemic started, we have been facing a lot of challenges, especially the members of the KP community. And when I talk of the issue of the sex workers, you realize that sex workers, we are used to working during the day and even throughout the night. But right now, with the ongoing curfew, you have to work up to 10 p.m. and then you go back home or you go back to wherever you go. So this has been a very big challenge because at night is when we have clients, so many clients. Because during the day people are busy, some people are busy doing other things. So at night is when we find our clients. But now when you realize that with the ongoing curfew, you have to go back home or you have to stop by 10. Because if you're found on the street past 10 p.m., you'll be arrested. And you don't want that to happen. So maybe your clients, that is the time that your client is coming. uh, Maybe you have to go home without money. You have children who are waiting for you. They want to eat. You have many other things that you have to do with the money that you get out of your work. But there is no money now. And you have many people who are looking up to you to support them. So you realize that as KPs, we have a lot of mental health issues that we are facing because we are trying to make ends meet, which are not meeting, which are not happening the way you want. So for us, what we have been trying to do, we try to tell our members to always ensure that they check onto each other. Make sure you call your friend, you talk to them. We have different social media platforms where we communicate. We try to sensitize our community to talk to them. If you have an issue, don't stay with that alone. Share it so that you can see how we can support you. Find someone whom you can talk to, because sometimes you have not seen a friend for 1 or 2 days and you assume that the person is okay, only to realize that later someone has passed on or someone is going through a lot. So we tell them always make sure that you call your friends and check on them. And also, it is high time for the government and the donors to ensure that there is some money put aside for mental health issues. We should look up to it. We should look on how we can have trained psychosocial counselors who can always be there so that they can always help the community to talk to them. Most of them, they can come from the community itself. Okay? And also, we have to have mental health safe spaces where sex workers or the community can be mentored holistically to get the services. Okay. And also to have peer-to-peer counselors who can talk to each other, because sometimes someone has a problem, but they fear facing other people to talk to them about it. But if it is through peer-to-peer, it is easy. They can support each other. There are people who maybe as Benta, I can be very free to share with. Maybe it is Archims. When I talk to Archims, I feel free. But because of the stigma, I cannot maybe go to a certain facility to talk to the healthcare workers about it. But if it is a fellow person, I mean a peer, maybe it is Archims. It is easier to face Archims, to talk to Archims about my problem. So it is high time for the government and our donors, all people who are supporting the community, to put aside some funding or some money which can cater for mental health care services. Thank you.
Thank you so much, Benta, for that valuable input. And I liked the closing point whereby you said, Yani, I'll wrap it up that we need resources to take care of our own being, to take care of the members of our society. So I can see that time is moving, and I'll provide each one of us an opportunity to give you closing remarks, yeah, you give your final input, but also this is an opportunity that we can make our clarion call to those who are listening, those who are following us. And this is material that will be there. It's material that we can carry it up for further advocacy, because the way we are seeing, it is no longer safe being a member of the KP. Yeah, looking at the violence, now it has been very extreme to points where people people's lives are taken away right in their houses. And you tend to wonder, what nature of a society are we living in? Somebody who has not touched you, who has not stopped you from going through your day-to-day work, you're coming to take away his life, forgetting that maybe this is somebody who supports his or her family. So, karibu Achims, you give us your parting shots, your closing remarks, and in case if you have any message that you'd want to pose outside there for the duty bearers, because this is a subject that is here with us. We can't sending away. We are giving birth to children. We don't know their future. We don't know who they will become. So, karibu, Zekiel.
One around the COVID-19, I have a concern that I'm putting up to the Ministry of Health. One, the police should do their work. If we really want to fight this disease, COVID-19, coronavirus, let's give the community health volunteers their spaces to educate the community around these diseases, because people will not listen to the police when they force you to wear a mask. People are wearing masks because of the police. They fear arrest. They don't fear disease. That is why people can only carry their masks and do not wear them in a crowded spaces. If the healthcare providers and the community health volunteers can be given a chance to go back to the community and speak honestly to their people, there will be change of behavior on wearing of mask, and also other measures that are in place. So let the police wait until there are people who have broken the law. Wearing the mask is to protect you and protect the other person, but it can only be done willingly, not by force. Even if you want to carry, we have few policemen and we have millions of citizens. Police cannot be enough to enforce the citizens to wear masks and to follow the guidelines that have been set out by the Ministry of Health. Let this work be given to community health workers. Second, there are a lot of these depressive symptoms on mental health around people during this COVID-19. We are urging the government to set up mental health centers and wellness centers for people to access the mental health services in every health facility. This will reduce the gender-based violence that we are seeing around, the killing, the murdering, the fight, the intimate partner violence that is everywhere, rampant in the country, is as a result of depressive as a result of depressive symptoms on mental health. This will reduce these things. Fighting and carrying demonstrations because of increase of GVB, setting these desks will not help. Let us do the basics of setting up mental and wellness centers in every health facility. People to open up and start talking the issues affecting their lives. This will reduce. And then if we want to fight drug and substance abuse in this country, let us train many addiction counselors as possible and start even posting them in schools, more so high schools and upper primary, so that this education of around drug and substance abuse will start at school. The prevention is better than cure. If the government is listening to the community and to the religious leaders, let us start talking about the issues that you want to talk about in low tone. Now be vibrant. Talk about them. Face your fears. But stop stigmatizing the key population. the sex workers, people who use drugs, and the LGBT community. They are your sisters. They are your sons. They are your daughters. It is time to start talking to your daughter and your sons. Thank you.
Thank you so much for those strong closing remarks. Like I always say, we are out to save our society and nothing more. So Karibu Benta, you give us your closing remarks, your parting shot, because I know there is somebody behind you there who will start demanding for their rights because time is here and we don't want to be in conflict with the rights of others. Karibu.
Asante. Okay, what
Yes.
I'll say is that with the ongoing pandemic, COVID is
Mm.
here to stay with us. We don't know when it will end, but all I can say is that the government should not put all the focus in COVID-19 and forget the other diseases. We have so many other diseases. Why are they just focusing on COVID-19?
Yeah.
We have so many other diseases we put a focus on. Like right now with the shortage of ARVs, what do they want us to do? Where will we get our next refills? We have been talking to the government every day and night, but they don't want to listen to us. That is also, we also need ARVs. We want them. We want them like right now. But every day we talk to them about our refills and they're saying there are no ARVs. It has been a cat and mouse game. So they should stop and focus on all the other diseases also, not just putting a focus on one disease. And also about the funding or the money, the money should be put aside for mental health cases. We have so many cases whereby we have people who have issues with mental health, not the KPs only. If they set up safe spaces for the community, it will help all of us, not only the KPs, but the general community will benefit from it. So they should put a focus on that also. And again, about the adherence counselors, we should have many from the community also who can help. The government should put a focus on the KPs also because they can help. Like what Achim said about people not putting on masks, they should have the community to help them because there is a saying that goes, set a thief to catch a thief. Let them come to us. We sit together. We talk about these issues and see how we can help each other instead of viewing us and stigmatizing or discriminalizing us. They should call us on a table. We sit down and see how we can work together moving forward. Thank you.
It has been a pleasure on my end. I mean, I know you had tight schedules, you running after deadlines. It's beyond work hours, but you responded to our call of joining us to unpack because people assume everybody is fine, and getting this opportunity to understand that key Ps are within us, they're within our society, and it takes a man to understand another man. At no point in time will I, as an individual, understand the mannerisms of an animal. If I walk into the jungle, the way the animal or the lion will react to me is different. That when we sit as us to just discuss and to find out how are things from both sides of the divide. I want to tell you, Asanteni Sana, for this time. Thank you so much for that input. We really appreciate. And I know nothing can pay for this time. Yeah, I'll say, let me give this, let me give that, but nothing shall repay this, because this is a resource that is going to last. It's a resource that will change the mind of our community. So until next time, tunawaambianga asante sana na tuwe na wakati mwema. Thank you so much. Good.
Thank you, Lord. Thank you. Good evening.
Thank you so much.